Well, Sacramento County Public Health has announced focus areas for blue zones. Those are well-being programs. The initiative includes and uses an evidence-based approach to make healthy choices easier in all of the places that people spend most of their time. Joining us this morning to teach us a little bit more about this is Health Services Director Tim Lutz. Tim, good morning. Thanks for being with us.
Thank you for having me.
Before we get into the details, explain for people what are blue zones.
Yeah, so blue zones, through research, they were able to identify pockets around the world where there are more 100-year-olds than you would expect, based on just other population. So they started to dig in and figure out what factors are really contributing to this longevity, and how do we start to replicate that elsewhere.
And let's talk here locally. Why are North and South Sacramento considered blue zones?
So we know from research that one of the biggest factors for your health isn't even your genetics, it's where you live. And so when we looked at Gallup data and looked at epidemiological data, what we found is there's a 10-year life expectancy gap between certain communities within Sacramento County alone. And that's where we then figured out these are the zip codes, these are the communities we need to target for these interventions.
And we're looking at some of this data now. The highest life expectancy, for instance, in Sacramento County, 83 years old, the lowest 72. What are some of the things that people can expect to see change?
So the process begins with a comprehensive transformational assessment. The idea is look at work sites, schools, community organizations, restaurants, grocery stores is a critical one, and infrastructure like parks, roads, sidewalks, and develop a comprehensive plan for the community for then leaders in government, private industry, nonprofits to really rally around to make these changes.
Where do things stand right now? Like, have there been things that have already been done?
So we've started off our stakeholder work group, which is key leaders across government and city, county, schools. And now the end of this month, we're going to be with the Blue Zones team on site in our communities, doing windshield surveys, meeting with stakeholders, really diving deep into what are these, let's look at these communities and really understand what's going on.
What period of time do you anticipate happening before these changes really start to happen? So you're doing that initial research right now, but at what point are we saying 5 years, 10 years from now, 20 years from now, do you expect these numbers to change?
We would expect, so the plan should be done in springtime. And that really is the next step for the call to action. And it could be policy changes, it could be system changes or environmental changes. Some of them can happen right away. Others, such as redesigning how your roads and sidewalks are, affordable housing, are things that have a longer horizon, but we need to have the policy recommendations and plans laid out.
Well, we will for sure stay in touch with you to find out how things are happening and how things are progressing in the county. Thanks so much for joining us.
Thank you.
All right, Deirdre, back over to you.